Hi, I'm Angela Smith, Doctor of Physical Therapy, and this is video number 2 about diastasis recti. In the first video, I taught you how to test for it to see if you have it and talked to you about exercises not to do and also exercise modification. This video, I'm going to show you some basic exercises that you can start doing, whether it be right after having a baby or a year out after having a baby. But this will be a good place to start for a foundation of strengthening your core and beginning to close that gap that you have in that abdominal muscle. Okay, these exercises that I'm going to teach you are going to focus on your pelvic floor muscles, your lower abdominal muscles, and your transverse abdominis muscle. The transverse abdominis muscle is the most important one that we want to engage, because remember, that's like a corset muscle that goes all the way around and helps to pull everything in. But the pelvic floor muscles kind of run into those abdominal muscles, and we need to have good support and strength down there, along with also having it help with incontinence or any leakage that you may have after like a vaginal delivery. But I always teach patients to do these in isolation to begin with. I want you to get really good at doing each of these exercises by themselves, and then we're going to combine them and we can progress them from there. So the first exercise that we're going to do is just those Kegels, if you've heard of that, or Kegels, but pelvic floor contraction. And when you do those, you want to lift your pelvic floor muscles up and in. Think about tightening those muscles when you have to go to the bathroom or you're trying to hold in gas. You want to contract that whole pelvic floor, and if you're doing it correctly, you shouldn't see any other movement when you're doing it. Some people will try and compensate with their abs or their legs, but you should be able to isolate it by itself without any other movement. So you can do that in any position. You can do it seated like I am here, or you can do it lying down. When you are going to the bathroom, a good test is to try and stop your flow when you're urinating, and you can feel if you're using the right muscles when you stop that flow. If you're unable to stop it, that probably means you're pretty weak. And that's not an exercise that you do routinely. That's just a test to do every once in a while, because that can back up the flow there. So just do that as a test to see, and then do the Kegels or pelvic floor muscle contractions just seated or lying down. And you want to hold that for a few seconds. I usually start out with just giving people like 2 to 3 second holds, but you can work up to sustaining a longer contraction than for like 10 seconds, and then relax. And hold again, hold, make sure you keep breathing, and hold it for as long as you can keep that sustained contraction, up to like 10 seconds or so. And then you can later also add in a more forceful, like powerful contraction where you're doing a strong, repeated contraction. But start with that sustained hold. The next exercise that I want you to do is a pelvic tilt. So if you lie on your back with your knees bent, what you want to do is think about pressing your back into the floor. So you're tilting your tailbone a little bit towards the ceiling, and you should feel tightening in those lower abdominal muscles. Sometimes you get some activation of the hamstrings as an assist, but I want you to relax your hamstrings and try and isolate more in the lower abdominal muscles. And you're going to hold that for 10 seconds. And again, keep breathing, and then relax. And do that. For each of these exercises, you can do like 10 to 15 repetitions to start with, and then work up to 2 to 3 sets of 15. But you're going to hold and relax, and when you get really good at isolating this exercise, then we'll build it on with the others. And then the next exercise is just that transverse abdominis contraction, or that TA draw-in, abdominal draw-in, whatever you want to call it. But you're going to think about tightening everything around your middle. Almost like you're trying to fit in a tight pair of pants, but you're not sucking in like that with your breath, but you're pulling your belly button towards your spine. Think about tightening all the way around. And if you think about exhaling while you do it, we can get a little assistance from the diaphragm with creating a vacuum and pulling everything in even tighter. So I take a deep breath and then exhale while I really pull that transverse abdominis muscle together. And that is going to be our major one that helps to close the gap. So again, we'll do like 10-second holds, 10 to 15 times, but make sure you keep breathing. So as I tighten that muscle, I should still feel my belly rise and fall, my diaphragm breathing as I breathe in and out, but I can still feel that my stomach is tight. And then when you get really good at isolating that, the pelvic tilt and the Kegels, then you're going to combine them all together. So you're going to do the pelvic floor contraction, pelvic tilt, and then the TA activation. And you're going to breathe normally and pull all those together and hold for about 10 seconds again, and then relax. Next, I'll progress you after you get really good at that to doing some more dynamic exercises with that pelvic tilt and abdominal drawn and the Kegels if you can do it as well. But you can start with just keeping that pelvic tilt and TA and extending your leg out. Now the important thing here is to make sure that your lower back doesn't pop up, that you don't create that space. You want to make sure you keep it down, protect your back, and keep that core activated. And just slowly extend out. If you can only go this far without letting your back pop, then you just go that far. But you can go as far as you can with still keeping that pelvic tilt. And then when that gets easy, after doing like 2 sets of 15 each leg on that, then you can progress it to doing more of a tabletop position where your hips and your knees are at 90 degrees. And then you're gonna just start with a tap from there. And this is, again, a little bit more challenging. So if your back starts to pop up, only go as far as you can with keeping that pelvic tilt and that back smashed into the floor. And then you can extend it a little bit further out as a progression. But again, as you do that, maybe you can only go this far without letting that back pop up. So that's a good progression for you to start with. And you can start these anytime, no matter how far out after pregnancy or anything like that that you have a diastasis recti from. So start with those basic exercises and then you can even progress them from here. But remember, no sit-ups, no crunches, no planks until you can close that gap to less than a 2-finger width gap. So hopefully that's helpful. Follow me and like and subscribe and all of that if you want more tips from me, a physical therapist. All right, good luck.